So hi everybody, this is week 3 of the Functional Restoration Program, and this is the third occupational therapy presentation on Tai Chi. And I have a couple of cartoons that are about Tai Chi. I will do Tai Chi here and there, I will do Tai Chi anywhere. And yes, that is true. I've had patients do Tai Chi on cruises, in Costa Rica, on the beach, in Hawaii on the beach, in their backyard, in their garden, in their home, at the park, in the water. You know, that's the good thing about Tai Chi. You can do it pretty much anywhere. So the model that we use here in this program is the Biopsychosocial Model, which I think is the mind-body-spirit connection. And that's really what I think Tai Chi is about. We're using movement is a physiological tool to break the vicious cycle of pain and to promote healthy brain and body changes. Movement is medicine, okay? And I use Tai Chi, or therapeutic movement, as a strategy aimed at changing, physiological and psychological factors contributing to pain-related disability. And let's just define Tai Chi as a traditional ancient Chinese exercise derived from martial arts. It's very low impact, so that's great for people. It can go up to moderate intensity, like if you're doing postures or movements that you're lifting up your legs and holding a stance. It consists of gentle, mindful, rhythmic motions, postures, and weight shifting. It's like a dance. It's an art. It's very graceful, very beautiful if you watch people in person. It incorporates diaphragmatic breathing and focused attention, which has an effect on your physiological responses and psychological responses. With the diaphragmatic breathing, you're learning that you're getting more oxygen to your muscles. You are lowering your blood pressure, you are lowering your heart rate. So all that is going to, in turn, relax your body. Tai Chi is often described as meditation in motion. And before we go over the benefits, really the most popular Tai Chi style that has been simplified is the Yang style, W-A-N-G, the 24 forms or postures. And really, basically, you're not going to stop separately like the instructor that you have in the YouTube videos. You're going to flow to the next posture movement without pausing. But I'm using this video for you to learn some movements, and then you can put them together into a sequence. So what are the benefits of Tai Chi? Well, it calms the fight or flight response of the nervous system, reduces stress, anxiety, depression, and mood disturbance, releases endorphins, hey, free drugs right here, and reduces the perception of pain, improves flexibility, strength, balance, coordination, enhances activity tolerance and cardiovascular function. And I got these benefits out of some evidence-based literature, research that I have at the end of this lecture that you can look at. See, these people look happy, practicing. Here are some 2 quotes that I like. This first one is the Harvard Women's Health Watch, May 2009. Tai Chi is often described as meditation in motion, but it might be well called medication in motion. There is evidence that this mind-body practice has value in treating or preventing many health problems. And then the next quote is, breathing in, I calm the body and mind. Breathing out, I smile. Dwelling in the present moment, and I know this is the only moment. And here are some resources, the Harvard book that you can get from Amazon, or you can check it out at the library. And some other resources, which this is an instructor that has taught me, Dr. Paul Lamb. He's actually a retired physician out of Australia, and he has a website, and you can find instructors near your city that have classes, and he also has published studies of Tai Chi for his own health programs that he's done. You can also order online streaming Tai Chi lessons from him, Tai Chi ebooks, and instructional Tai Chi DVDs. He also has free YouTube Tai Chi health programs. They're more educational videos. He does a really good job of just kind of introducing you to it, and talks about kind of the alignment posture of things that you want to know about Tai Chi. Then you have Dawn that has the 20-minute exercise, and Tai Chi 20 minutes and 9 minutes that you can go to. And there's a lot of other Tai Chi, Qigong instructors out there. It's just you have to discern whether you can do the movements or not, or do you understand kind of what they are saying. And normally we would get started and practice in a session. And here is the evidence-based research articles that I talked about when I talked about the benefits of Tai Chi. So really the bullet points, what I want you to remember when you're practicing Tai Chi or Qigong is staying relaxed. If you can stay relaxed, that helps, then be intense. Maybe, work on learning the movements first before you apply the exhale and inhale, and maybe choose one movement that you've learned well and start practicing inhaling and exhaling. Remember to keep your joints soft. You don't want your knees hyperextending. You don't want your elbows locked. Really, you want to think about maybe your arms or your hands as balloons or leaves floating through the air. You just want gentleness, and it's just gracefulness as you practice the movements. That's what you want. And that's really it. It's just about practicing and eventually learning, practicing and then eventually learning these movements and then stringing them together. And there is a lot, like I said, out there. And some of you may want to attend a Tai Chi class. And so you will get some handouts on some where you can find some Tai Chi classes. Some of you might want to just be at home and watch some DVDs that you can get from the library. Or I have some recommendations too. All right, keep practicing.